Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. I want to thank you and welcome all of you who are joining us on GoToWebinar, Facebook Live, YouTube Live, and Twitch. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions in the GoToWebinar chat box. MS navigators are online throughout today's program, answering questions and connecting you with resources. There's innovative research and real progress being made when it comes to understanding the potential use of different types of stem cells for slowing MS disease activity and repairing damage to the nervous system. We're being joined today by Dr. Jeffrey Cohen, director of the Cleveland Clinic Mellen Center for Multiple Sclerosis Treatment and Research and the Mellen Center Experimental Therapeutics Program. And we're discussing what stem cells are, their potential benefits in MS, and the latest updates in stem cell research. Welcome, Dr. Cohen. Thank you for being with us today.
Well, thank you, John, for the invitation.
Why don't we start at the very beginning? What are stem cells? What properties define a stem cell? And where do we find stem cells?
Well, so stem cells are defined as primitive cells that have the capability of doing several things. First of all, they can divide, so they can replenish their own population. But more importantly, they have the ability to develop into other more specialized cells. So the prototypic stem cell are the cells that make up the very earliest stages of the developing embryo. In that case, they give rise to all the tissues of the body. But we also now know that there are stem cells within most of the tissues of the adult body. And in that case, their job is to repair damage that occurs either from normal wear and tear, trauma, or from disease. In medicine, we want to utilize those properties perhaps to treat human diseases.
Well, I know that stem cell research in MS is rapidly expanding in what looks like many different directions, seemingly all at once. I think maybe before we go too much further, I'll ask you for one more definition. Can you tell us what stem cell therapy refers to?
So stem cell therapy refers to therapeutic approaches that either utilize stem cells directly, so that would include transplantation, so taking stem cells out of the body and putting them back in, or I like to use it more broadly to also include treatment strategies where one administers a medication, for example, that works through stem cells by stimulating their normal activities.
What types of stem cells are researchers evaluating for potential benefits in treating MS?
Well, I think generally speaking, stem cell therapies in multiple sclerosis fall into two broad categories. One would be as an immune directed therapy, in which case, that would be typified by hematopoietic stem cell transplant, in which case one administers a very potent immune therapy which eliminates the immune system, and then it's replaced using hematopoietic stem cells, the stem cells that give rise to all the blood forming cells. So that's one category of stem cell therapy. And then the other sort of general category of stem cell therapy would be therapies intended to promote repair, either to repair the myelin or to replace the nerve cells that are also damaged in multiple sclerosis. So it's important for the audience to remember that one cannot just think about stem cell therapy. One has to be a little bit more precise and define what type of stem cell therapy one's talking about.
Well, I heard you mention hematopoietic stem cell transplantation. I guess I'm going to ask you for another definition. Can you tell us what exactly that is? I know it's also sometimes referred to in short as AHSCT. What is
Right.
that?
Well, that's because hematopoietic is very difficult to say quickly. So the hematopoietic stem cells, as the name suggests, are the stem cells that give rise to the cells that form the blood. So the white blood cells, the red blood cells, and the platelets, small cells that produce clotting. So hematopoietic stem cell therapy involves eliminating the existing immune system in some way, usually by potent chemotherapy, but there are some other approaches. That's the actual therapy for multiple sclerosis, because as we know, the damage in multiple sclerosis to a great extent is caused by malfunctioning of the immune system. And then to administer hematopoietic stem cells to promote recovery of the immune system. The part of the reason why that's necessary is that most of the complications of hematopoietic stem cell transplantation occur at the time of the so-called conditioning regimen. That's the treatment that eliminates the immune system. So during that period, the person undergoing hematopoietic stem cell transplantation is prone to infections because they don't have an immune system. But also, sometimes other aspects of the bone marrow are damaged as sort of collateral damage. So the other white blood cells, the red blood cells, the platelet forming cells. And so the transplant in that case is also administered to speed up the recovery of that aspect of the bone marrow to prevent the complications that might cause, like bleeding or anemia and so forth. So the key point is that the aspect of transplant, in this case, that's the therapy, the treatment for MS, is the elimination of the malfunctioning immune system. And then the transplant is to rescue the patient and to shorten the period in which their bone marrow is not functioning. And then the ultimate goal is that the new immune system, as it forms, will function more normally. It'll have more normal regulation, and it'll have more normal specificity. It will not attack one's own body. So that's why it's been likened to rebooting the immune system. That's the term that's sometimes used.
And who will most likely benefit from this particular treatment?
Well, so over the years, there actually have been quite a few studies of hematopoietic stem cell transplantation in multiple sclerosis. And from those studies, we started to get a good idea of who's most likely to benefit and who's most likely to experience harm, have complications. So the person that's most likely to benefit is someone who has very active relapsing MS, meaning they're still having relapses or active MRI scans, and who does not have, and who is not too old. So younger people tend to benefit more, and who does not have too high a level of disability already, mostly because in those people, MS most likely is primarily progressive. The progressive aspect of MS does not appear to respond as well. And also, people that are older with more severe disability are more prone to complications. So and then the final aspect is that generally we look to see that people have at least tried some of the available disease-modifying therapies and have not derived sufficient benefit. And that's because, at least in my mind, hematopoietic stem cell transplant is still somewhat experimental, and it's still a risky procedure. So we want to at least utilize it in cases that the most appropriate.
Well, we've heard from Paula, who wants to know what kinds of things she needs to consider in selecting a safe and, as she puts it, a credible place for getting a bone marrow transplant or for getting
Right.
this.
Right. So there's been a lot of publicity about hematopoietic stem cell transplant. So as a result, there's a lot of interest in it. So there are a couple of aspects that one should investigate before proceeding. The first, and I think most important, is that the program offering it needs to have expertise and experience in hematopoietic stem cell transplantation, because it's a very complicated procedure and still somewhat risky even under ideal circumstances. And also, they need to have experience and expertise in managing multiple sclerosis. Things can go haywire with MS during the procedure, and the program needs to have expertise in how to manage that. And then some other, I think, important things that sometimes are not so obvious is there needs to be a plan for communication with your physician at home, to make sure that the transplant program has all the information they need about you to do the procedure safely. And there also needs to be a plan for follow-up after the transplant procedure when you go home, because care doesn't stop when you walk out the door of the transplant facility. There still is some ongoing care that's required, and that needs to be planned in advance. So those, I would say, are the most important things.
Well, when it comes to patient care, can you tell us how MS specialists are involved before, during, and, as you just pointed out, after transplant?
Right. So beforehand, they play a role in determining whether someone's an appropriate candidate for transplant. Is their MS likely to benefit? And conversely, that they don't have other characteristics that might make transplant more dangerous. They don't have other diseases, for example, that can increase the risk from the transplant procedure. During the transplant, it's actually not uncommon that people note worsening of their MS symptoms. Usually just as sort of as we call a pseudo relapse, when someone has almost any other kind of medical condition. Sometimes MS symptoms can be accentuated, but sometimes people can have a bona fide relapse. Some of the components of the transplant procedure can trigger that. So the MS neurologist would be involved in assessing whether someone's having a relapse and helping manage it. And then after the transplant, there are some potential complications sometimes. For example, people can have reactivation of virus infections, so CMV and EBV, herpes viruses, frequently get reactivated after the transplant because the immune system hasn't quite developed back to normal. And sometimes the transplant doesn't work as well as we would have liked, and the MS needs to be managed the way it would otherwise. And so the neurologist plays a role in that.
Well, we've talked about the use of stem cells to reboot the immune system, but there are other cell-based strategies to treat MS that are based on remyelination.
Right.
So can we first take a step back and review what causes demyelination or loss of myelin in MS? And then maybe talk a bit about what remyelination is and some of the strategies being studied to promote remyelination.
Right. Right. So the nervous system has a number of different cells in it, but two important cells are the neurons. So those are the nerve cells. Those are the wires. And then there are the oligodendrocytes. Those are the cells that make myelin, which one can think of as the insulation on the wires. And one of the key aspects of the damage that occurs in multiple sclerosis is that the myelin gets damaged. Also, sometimes the wires, the neurons get damaged too. But oftentimes, the myelin gets damaged and the wires are preserved, but because their insulation has been damaged, they don't work. But we do know that the brain does attempt to reform the myelin once it's been damaged. That actually can be quite robust early in the disease, but as the damage from MS accumulates and as we get older, the ability of the brain to repair the myelin becomes less robust. Like everything, as we get older, we don't heal as well. So one of the strategy, and so we think that persistent remyelination has two consequences. One is that it contributes to the symptoms, the disability that can accumulate, but it also sets the stage for progression. It sets the stage for the neurodegeneration that we think underlies progression. So there's been a lot of interest in trying to augment the body's natural ability for remyelination. So, and that's where some of these cell-based stem cell strategies come in.
Well, when it comes to some of these newer strategies that are being studied to promote remyelination, in trying to replace those myelin-forming stem cells, those oligodendrocytes that you talked about, can you explain how that therapy might work and whether there are practical or ethical limitations
Right.
to that particular procedure?
Well, so one obvious way of doing that would be to transplant the oligodendrocyte stem cells, the so-called oligodendrocyte progenitor cells. And that's been discussed quite a lot. It does present some challenges. One is that those cells would likely have to be obtained from developing embryos or derived from so-called embryonic stem cells. So that presents a number of sort of obvious practical and ethical issues. But more importantly, it turns out that a shortage of those cells probably is not the problem. That's probably not why we don't remyelinate. It's probably more because there's something in the environment in the brain that's affected by MS that interferes with that natural process. Either there's some obstacle, something that's toxic in the environment, or there's something missing. So much of the recent research has been to try to create a more hospitable environment to remyelination, and that's where some of the other strategies come in. One strategy is to transplant a different kind of stem cell, so-called mesenchymal stem cell, and the other approach is to use medications to try to create that more hospitable environment. And both of those approaches have their pros and cons, I think.
Can you tell us what mesenchymal stem cells are and what we're learning from the clinical trials that are focused on using those stem cells to treat MS?
Right. So mesenchymal stem cells are yet another kind of stem cell. I've already talked about several different ones. So those are stem cells that are present in most of the tissues of the body, including the nervous system. They tend to live around blood vessels. That's their natural home. And they have a couple of jobs. One job is they actually function as stem cells, and they give rise to tissues such as bone and connective tissue and fat, muscle. But they also have another important job, which is that they produce a large variety of factors that support the growth of other cells. And also that modulate inflammation. So it's almost as if they're there to regulate natural inflammation when it fights infection, for example, and then to repair the damage that might occur after an infection or after damage to tissue. So the idea has arisen that perhaps by transplanting large numbers of mesenchymal stem cells, we might be able to create a more hospitable environment in the nervous system and to promote the natural repair processes that it's already attempting to do. And so there have been quite a few studies of mesenchymal stem cells in multiple sclerosis that have shown some promising results.
Have there been any limitations uncovered or concerns voiced about using these mesenchymal stem cells to treat MS?
Well, I would say the main concern is that we don't yet quite know exactly how to do it the best way. There are a lot of questions about and very fundamental questions like where should those mesenchymal stem cells come from? Should they come from the person themselves, or should they come from somebody else? Because one might postulate that, well, that person has MS, they're not repairing their own damage, so maybe there's something deficient about their ability to repair damage. So maybe we should give cells from somebody else that are more effective at that. But even beyond that, we don't know how to grow them in culture to make them the most therapeutic, how many to inject, whether we should administer them intravenously or by spinal tap, whether repeated doses are needed, and so forth. So those are some pretty fundamental questions. We're starting to get a handle on that. It now looks like administration by spinal tap and administration several times is more helpful. And with some of the more recent studies that have done that, we're now starting to finally see some promising results, some indications of benefit.
In the United States, there are literally hundreds of unregulated stem cell clinics that claim to have cured people who are living with MS. However, it should be pointed out that not one of these clinics has provided medical evidence that their treatments work or are even safe. Dr. Cohen, what can you tell us about stem cell centers that pretend to be regulated and safe?
Yeah, so I think that's a very important point. I caution my patients about pursuing stem cells through one of those clinics for a number of reasons. One is, as I just outlined, the field does not yet know how best to administer that therapy, including the people in those clinics. Secondly, what they're exactly doing is never clear, and whether they're doing it safely, whether the cells are clean, in other words, they're not contaminated, they're not going to cause infection. And as I was talking about earlier, there's almost no prior information provided to those clinics about the person's medical history. So, and there's almost no plan for follow-up afterwards. So if someone gets a complication, which some people have, it's left up to the patient and their doctor to pick up the pieces. So I think it's premature to be pursuing this through commercial clinics.
Well, we've covered a lot of ground today, reviewing some of the promising research efforts on cell-based therapies for MS. I'm looking forward to continuing our conversation next week when we'll take a deep dive into stem cell transplantation in MS. But before we get ahead of ourselves, I'm hoping you could share the top 3 takeaways that you'd like our audience to remember.
So I would like people to remember that one, stem cell therapy is an exciting new approach for MS. 2, that there are a number of different kinds of stem cell therapies, and one needs to be clear which one you're talking about. And 3, although several of those approaches show promise, none of them is completely ready for prime time in my view.
Well, I'd like to thank everyone who submitted questions, and thank you, Dr. Cohen, for being with us today.
Well, thank you for having me.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current and credible. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to navigating or connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll find ways to get involved, and you'll see upcoming events that are occurring near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Cohen for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. And I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics right on the MS Society's website. Now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Jeffrey Cohen and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.